the smartphones and tablet technology is still sort of relatively new to healthcare. Everyone wants to get in on it because of it's very attractive in terms of how quickly it comes on, how long the battery lasts, the ease of use. So there's a huge buzz, a huge interest for smartphones and for tablets. Typically what we find is the tablet is a lot better for retrieving data. So if you are wanting to look up a lab or look up clinical notes, things like that that are within the electronic medical record, tablet is very quick, very efficient way to do that. The second you need to take it to the next level and do something a little bit more input-based, write a new order, write a brand new note, make referrals, that's where the tablet starts to get a little clunky. And part of that is the user interface that these electronic medical record companies are still working through. It's just not elegant for that purpose. So at VCU, we actually have a very robust electronic medical record. We use a product called Cerner. We have it throughout all of our clinics and all throughout our hospital. But we also use a web-based as well as a smartphone or tablet-based retrieval solution called Patient Keeper. So basically there's an icon on my phone or on my tablet that I can click in and have full access to sort of a web-based version of our electronic medical record. And so you will see a lot of times on rounds or when they're taking care of patients, you'll see the doctors pull out their phone or pull out the tablet to do some quick lookup right before going to see a patient or right after. It's very helpful, especially when I'm away from the hospital, to keep tabs on my patients. There are a variety of medical apps, a lot of them are even free, where that stuff is now at your fingertips, whereas before it was within a book or it had to be up here. And I think the body of medical knowledge is just way too vast to even remotely believe that you could maintain it without having some sort of technological aid. There are downsides to over-reliance on technology. I mean, if you think about it, a pen and paper never needs a plug. A pen and paper sort of always works, and it doesn't require a lot of user training and education. The best apps are the apps that you don't have to think about. That you can just pick it up and use it and understand exactly what your gestures, what your swipes, what to click. And that's where we're really leaning on the industry to improve. Will the tablet ultimately replace the desktop PC? I don't know, but it will certainly augment it, as it's already starting to do. And I think another thing that people think about is it almost starts to become financially more attractive to have a cadre of fixed PCs supplemented with tablets, which are a lot cheaper than having a full PC. And so you're probably going to see that in the near future as the mix of the technology in these installations is going to start to, just like it has in your home, you're going to start to see the fixed PC go like this and the tablet go like that.